Hey girlfriend, this is Jan James. Welcome to the Hope After Breast Cancer podcast, where women who have endured breast cancer learn to have fulfillment over frustration, clarity over confusion, and faith over fear. We tackle the issues that many of our sisters face after a breast cancer diagnosis, from brain fog to fear of recurrence, from menopause to sex after breast cancer. This is the place to learn how to have hope after breast cancer. So strap yourself in. Welcome to the Hope After Breast Cancer podcast. Hi, it's Jan James from Hope After Breast Cancer, and I have been waiting for this day for a while now. I'd like to introduce you to my old friend and Hope After Breast Cancer contributing expert, Dr. Melody Rodarte. Hi, Dr. Rodarte, how are you?
Hi, I'm good. Thank you for having me.
No, we're so glad. This has been a long time in coming, but I'm really excited about it. Friends, what we're going to do today is open up a conversation about a topic that I think all of us in the breast cancer community want to know about. I just want to encourage you to open your minds to some new learning today. And Dr. Rodarte is going to help us go through that. But several months ago, she and I were having a conversation, and I was sharing that so many of the women in our sex after breast cancer group are just really struggling with intimacy issues after breast cancer treatment. It's painful intercourse, it's lack of libido, it's a bunch of things, and it's so heartbreaking for me. And I was telling her I was an ER positive person, and because of that, it was really put into me that I needed to stay away from anything estrogen. And so I just told her how heartbroken I was about these women that were deciding on, this is my learning, deciding on choosing quality of life over fear of recurrence by using vaginal estrogen. And I think your comment was something like, yeah, I don't want to talk to you until you read the book Estrogen Matters. And so this is the book. It's called Estrogen Matters. It's written by Dr. Avrum Bluming, who's a medical oncologist, and Carol Tavris, PhD, who is a psychologist. The subheader here says, why taking hormones in menopause can improve women's well-being and lengthen their lives without raising the risk of breast cancer. They also have a website, estrogenmatters.com, that you can go to, but we're going to have a wide-ranging talk here today. So, Dr. Mel, can you tell us a little bit about your background and why this is a subject that's near and dear to your heart?
Yeah, thank you so much for having me on. And I'm excited that if I can just help others, these women on here have a good relationship with their body and their physicians they choose or practitioners, then this is all for good. Right. I am a doctor of osteopathic medicine. I chose to go that route. So it's a DO because I wanted to incorporate Eastern and Western medicine. That was important to me. And I remember running around the hospital as a candy striper, if you guys all remember candy stripers. And I could tell the difference with certain DOs. They held the hand of their patient. They wanted to know more about the family life or the patient's life. So that really spoke to me because I didn't want to just treat my patients for their disease. I wanted to know all about them so that I could help them heal and prevent. I was really into prevention. So I became an internal medicine physician because I wanted to empower adults to take better care of themselves. And then I went on to do some other training in hyperbaric medicine and medical aesthetics and even weight loss. So I'm obesity medicine board certified as well. And my journey into hormones started very early because women wanted to know what was safe to use. I want better sex. I want better, I want my hot flashes gone. So even in my beginning years in 2006, I was kind of on that track of how do I help my patients with hormones and move through menopause? And then it really hit home when my mom was diagnosed with breast cancer at the age of 52. And I'm thinking, nobody else in her family had breast cancer. She's first generation to come here to the United States. What was she exposed to? and then she had a reoccurrence at her 5-year mark as well. So it just was really eye-opening to me, going, what am I going to do? Because now am I at more of a risk because my mom had it? I had a daughter by then. So I'm thinking, and it's on my husband's side. So I'm thinking about my daughter. What is she at risk for? What are things I can do starting in the beginning, to decrease her risk? And so that's kind of where my journey started. And so I hope that's a quick snippet.
No, totally. So what did you learn in medical school that helped you advise your patients? And then how has about estrogen? And then how has your knowledge changed, and how do you advise your patients these days?
So I barely learned anything about this in medical school. I hate saying it. I'm an obesity medicine specialist. Guess what? I didn't learn about nutrition in medical school there either. So it's all the extra training I've done afterwards. I've done probably 3 now certification courses when it comes to hormone therapy. So I've continued to do continued medical education because, in my opinion, it's very important for me to know what's the latest and greatest and what's the literature and what is everybody doing. So that's how I've continued to educate myself. And as I said, when I first got started, I had women coming to me with these issues. And so that's where my journey, I decided it was important for me to become an expert there because I felt I wanted to help them out. So that's really where the journey started. And, I didn't even think about this. I have endometriosis, and I had been on chronic birth control to control it. And so in my head was thinking, when my mom was diagnosed, like, what do I do with myself now? Do I stay on birth control? Am I at a higher risk? So I think it's personal. It's been a personal journey, as well as I have a passion for women's health. And so I really wanted to be educated and help my female patients out.
Mm-hmm. So early on, were you advising them against the use of estrogen, or how did you look at that?
Actually, no, I was one of the big proponents early on of compounded estrogens, compounded hormone therapy. So I was not the big fan of I would say, I think my journey was so early with trying to do things naturally first. So even back in 2006, I had teamed up with a couple of compounding pharmacies to say, okay, here are my patients' blood work. These are their symptoms. This is where I want their ranges to be. And I would work with them on like creams and oral replacement. I really didn't do the prescription thing that you'd get from Walgreens or Osco or Safeway. I think at that time I already saw the difference, I think, with the courses to go the natural route as much as possible.
How interesting. Wow. So, okay. So, you and I have talked a little bit about my background. So, let me think, 3 years prior to me being diagnosed with breast cancer, and my diagnosis came in 2012. So that would be 2009. I was, let me think, I think I was 49 or 50, probably just 50. And I was so out of fuel, like I was exhausted all the time. I didn't have a very sharp brain. I just felt depleted completely. And I was working at the church I went to at that point, and one of the gals that I worked with said, oh my gosh, I went to this place in Scottsdale and saw the doctor there, and they did my blood work, and they gave me these estrogen pellets, and my life has changed. You've got to go do it. She was like a total cheerleader for BHRT, which is bioidentical hormone replacement therapy. And I was really at the end of my rope, honestly, and felt like I had been seeing a lot of doctors trying to figure out what is going on with me, and nobody seemed to have answers. So I ended up going to that place. It is a doctor's office, but I always called it the Pellet factory because the women going in and out of there, it's like, it is almost industrialized. It's like next, and I would get a pellet every 3 months. And I was just telling you during that season, honestly, I look back on it now many years later, and I actually had drug seeking behavior because the pellet only lasted so long, and they would not give me a replacement pellet for 3 months. And I can remember calling and begging them like I was a heroin addict. No, you don't understand. I need to get back in. I don't have any more estrogen in me. And it was, if I look back at it now, the power of estrogen was almost scary to me at that point, that it made me feel so much better. But then take that situation and go forward 3 years, I'm diagnosed with ER positive breast cancer. And I'm told the words, your cancer is fueled by estrogen. It doesn't take a rocket scientist to know that that's not a very hard leap to say, oh, it was the pellets that did it. It was the estrogen in the pellets that did it. If I have estrogen fueled breast cancer. And on top of that, my precious oncologist, who I have just been treated so well by her and her staff, and I feel like I've gotten excellent care. But she also said to me over and over again, ER positive cancer, no estrogen products whatsoever, no vaginal estrogen, no edamame, no lavender, no soy, no. So that was, it just was pounded into my head. So then fast forward to 2017, when I started the Sex After Breast Cancer group, I was being a total mama bear to my girls, which is what my nickname is. And because they would be talking about, oh, I'm going to start vaginal estrogen because I just can't stand how bad my sex life has gotten. I've got too much pain. I have no desire, yada. And they were wanting to salvage their marriages and their relationships and such. And I was like, no, don't do it. And now I feel so foolish and so regretful that I didn't know what I didn't know. And I think that even certainly they were making personal decisions based on quality of life that I should have stayed the heck out of. But now I feel really foolish because there seems to be a growing list of studies that say that estrogen is not bad for me. So can you break into that?
I think what you're really hitting on is medical knowledge takes forever to change, unfortunately. And sometimes it gets stuck in our head and we don't want to change. And you really got into that. You had an oncologist who you trust, right, telling you this information. And I think that's why this book, Estrogen Matters, is so important in having that conversation, because our bodies need hormones. And just because you had an ER positive breast cancer didn't mean the pellet caused it or fueled it, because you had other sources of estrogen in your body. The types of estrogen make a huge difference. So Premarin, I would never prescribe that. The synthetic estrogens, they're an issue. I will wholeheartedly still say a synthetic estrogen is not the same as estradiol made from a yam or naturally compounded.
What does what's synthetic mean though? Can you break?
So synthetic means like the type of estrogen that you're going to get from a CVS, a Walmart, a prescription that your doctor might be giving you, and it's a synthetic estrogen. So estradiol is the natural form that you would want to seek out, would be an estradiol. And our adrenal glands, there's other where we have estrogen in our body. We need it for our other tissues to function, our brain, our heart, our metabolism. So when we shut down that process, we got to think about, it's okay to get some other forms of estrogen in our bodies. So some food and I should say it this way, you can't eat enough edamame to make your breast cancer come back. You just can't.
Hallelujah. I'm going to the store after this interview.
Yeah.
Seriously, I've missed it. No, I always felt like it was such a healthy snack for me. And I was heartbroken about it. But no, that's awesome to know. You know,
and it is.
Go ahead.
I want women to eat healthy. That's the biggest thing. They start getting afraid of food. So the biggest thing I would say that it's carcinogenic, processed foods. Stay away from processed foods, period. End of story. Eat everything natural. Do organic when possible, because you want to avoid organophosphates and antibiotics and all that kind of stuff. But eat a healthy diet that actually is your best defense for any type of cancer. Because as we get older, colorectal cancer I'm what I'm more worried about. And guess what increases that? Nobody talks about hot dogs, processed meats, deli meat. I mean, so we don't even need to go down that road. But you know, think about that nutrition and what's going inside your body, because that's when we want to reduce other forms of cancers. You know, we kind of get the blinders on. It's only the breast cancer. Well, we want to avoid other things as we age. So a healthy diet overall is going to really help everything.
Oh, right. I'm going to take a minute just to read something from the book, because I think that a lot of our women are sitting there going right now, okay, wait, no, my aunt told me the same thing. And okay, so I get you, I feel you, but like Paige, I want you to get this book. I mean, and you need to get the book for your oncologist too. We're going to talk about that. But on page 11, even, it says some normal breast cells have on their cell membranes receptor molecules for estrogen, and many women diagnosed with estrogen receptor positive breast cancer assume, understandably, that this means estrogen is somehow feeding the kind of breast cancer they have. But no. If that receptor is found on the membrane of a breast cancer cell, it usually means the breast cancer is growing slowly enough to adopt this normal cell characteristic. The presence of an estrogen receptor or a progesterone receptor on the surface of a breast cancer cell does not mean that the breast cancer was caused by estrogen or progesterone. Newsflash. And guys, in this book, when you get it, there are 50 some pages of studies that have been done about all of this. It is so well sourced, which is really important. So I think that's one thing like I'm working on. Okay, so my estrogen pellets did not cause the cancer. So there's one thing, but now, and in fact, there's a chapter in the book that says, does estrogen cause breast cancer? The first first 6 words say, yes, it does. No, it doesn't, in that chapter, which I really laughed about, you know. So anyway, so we need you guys to take your own initiative. You need to do your own research. You need to be proactive in this. Can you talk about what is the best way for us to go to our oncologist to say, hey, I'm thinking about this? Or one of the girls in the group, even after I did a video just introducing this interview, said, well, I went to my aunt and she went nuts. So, you know, so we have to kind of steel ourselves and go, okay, it's going to take a while to get the information out there. So what's your best advice on that?
So one, I would say, have a great relationship with your oncologist. Bring the book with you, because I think it's really great. Gift it to them.
Right.
Maybe highlight some areas, especially the research, and say, I want to continue having this conversation with you. I'm not going to go behind your back and do something, or I'm not going to just fire you because you won't have well, maybe you fire them if they won't have a conversation. But I always believe in, Jan, you can second this if you want to or confirm it. You need to have a conversation with your team, with your doctor. And I always would tell my patients, there's no such thing as a dumb question. If I don't know the answer, then I'm going to go look it up. I always want to have a conversation. I'm never going to tell you what to do. I might recommend things, but I'm not going to tell you. I'm not your mom. And one of the things that's really important is having that conversation. I think it's a great book. You're not bringing a blog. You're not bringing something that so-and-so said. It's very well put together, this book, and it has so many resources in there. So I'm going to make this little star after my with what I'm talking about. in the first 5 years post breast cancer, I wouldn't be pushing this. In the 5 years afterwards, you are 5 years clean. We kind of have a good picture of what's going on. Let's talk about now, what are things that we can do to get our life back together? And it might be at the 2-year mark or a 7-year mark, but I say generally that 5-year mark, we want to make sure that we are cancer free. And most of those estrogen type medications, they really want you to have those on board for 5 years. If you're ER/PR positive, you know, the major ones that are being used, but they come with a lot of side effects with continued use. So I want one of the questions to be to the oncologist is, what are my risk factors now? You know, it's after 5 years, because I'll tell you, for me personally, I want to live with vibrance. So if my decreased chance of breast cancer is only reduced by another couple percent by continuing that therapy, my personal choice is to go off, because I want to have life. And I know that I continue to have every year, I'll get my blood work done, I'll get my mammogram or my ultrasound or whatever needs to be done to monitor me. But I want to reduce the chance of strokes and heart attacks and dementia and osteoporosis. And I want my quality of life to be excellent. So you have to make that decision for yourself, everyone. So being able to have that one-on-one with you, and it might take, that oncologist might say, you're going to have to come and talk to me once a month, just make an appointment. We'll keep touching back on this subject, because they might only have a 15-minute appointment with you. They might have a 30-minute appointment with you. So you need to ask, can I make a longer appointment with you next time? And we go over these, I have a lot of patients who bring a list of other questions, and sometimes they'll leave them with me. I have time, and they know that I might charge them to go over all of this, and I put it all together and I give it back to them when we're all done, or we have a conversation face to face. So I think you got to have a conversation.
Well, and I'm such a proponent of being your own advocate. There's no one that will fight for you like you. There is no one that knows you like you. And so really, again, doing your own research, thinking through this, certainly talking with other women in the community, calling me, whatever you want to do to just talk through the process, I think is totally fine. But one of the things that I was stunned at, my ignorance is wide. It's just so wide. There's so much I don't know. And I'm just like you guys, right? I'm not a professional anything. I'm just Jan. But when I looked at the back of this book, there's no current way to prevent or treat Alzheimer's disease or other forms of dementia except estrogen. Get this, 7 times as many women die of heart disease as die of breast cancer annually. What was that? 7 times as many women die of heart disease as breast cancer every year. In fact, heart disease, not cancer, is the leading cause of death amongst breast cancer survivors, and HRT can reduce that risk by 30 to 50%. Come on. What other things? Bone strength, right? I read something about
muscle. We need our muscles. That burns our calories. It makes our bones strong. So many things we need hormones to live. We do. And our adrenal glands are going to pick up the pace if you had your ovaries removed and your uterus removed. And so they're there. There's not a state where your body's not going to find a way to kind of get some hormones in there. And so and I am very thankful. We can go back to just giving gratitude and thanks. I'm so thankful we have chemotherapies and we have things to make it through when that breast cancer is diagnosed and we are in the fight of our life. But once that's done and we get to say, hallelujah, victory, it's now, okay, how do we get our vibrancy back? What are things that we can do to help us still be connected to our husbands, our family, our girlfriends, our life? It's so important. It's called, I don't want to extend this, like there's health span and there's lifespan, right? Health span is different because you're an active, where lifespan is just like, you're alive. Yay. We gave you 5 more years. Yeah. But if you're miserable, that's my choice. My choice is to be active. So I would choose health span over lifespan.
Right. That's great advice. You talked about the couple of point differential, in doing a treatment or not doing a treatment. And I actually learned how to get the numbers from my oncologist. She's a researcher by background. And she said to me, you can always ask your oncologist, what is my percentage of recurrence and mortality with and without a certain treatment? So I always encourage our women to do that when they're complaining about a hormone blocker and the side effects of a hormone blocker and things of that nature. My easiest example is that Angelina Jolie got a prophylactic mastectomy because with her breasts, she had an 86% chance of getting breast cancer and a 5% chance without them. That's a no-brainer. Your numbers may not always be that dramatic, but they could be. So is it the same with you as far as I could ask you for numbers about various treatments?
Yes, and I'm not the expert when it comes to all those different ones, but I will say the most common one, like tamoxifen, anastrozole, they're usually past that 5-year mark. You're only getting a couple percentages of breast cancer free time. And a majority, and I'm a little skewed because of course I get more women with issues, they're having joint pain, they're having brain fog, they're having night sweats, they're having weight gain. So for them, it's not worth the extra 1 to 2% decrease in the chance. They want to start thinking about other things that they can do. And there are, we can go into that now. You don't have to do hormones. There are other things that you can do, like food wise, supplement wise. I think the most common one that women love to try out is evening primrose oil. There are different things that you guys might have this on your blog, and I apologize if too, but there are those natural things, that women can do in optimizing their vitamin D and, getting their inflammatory markers down, changing nutrition, exercise, sleep. Sleep is so important. So there are those things that really can help reduce some of the side effects and give that life back. If you're worried about hormones, to try first. And here's one that I think a lot don't think about because they think it's only for men, is testosterone. Testosterone is not going to increase your risk of your breast cancer coming back. And that a touch of testosterone might be all you need in this maybe in the interim to kind of just give you a little bit of your life back while you're trying to figure out some of the other therapies that your oncologist is hemming and hawing of approving or disapproving of. But testosterone is really important for us as women. It reduces our chances of Alzheimer's. It does help our heart health. It helps. A lot of women go, oh, I'm going to bulk up. I'm like, no, this isn't the synthetic that, Arnold Schwarzenegger did and everyone else injecting themselves, and getting muscles. Just bioidentical testosterone. We as women, we need our muscle strength back. It's not going to make you bulk up, but a little bit might take the edge off of things and make you have your libido back, make your brain fog go away, little tiny things.
So what kind of doctors would we see about hormone therapy? Is it an integrative doctor like you, or what kind of?
There are. So I'm not an OBGYN, and there's a lot of us who are homeopathic or integrative, personalized medicine, integrative. You might hear any of those types of words, and we'll talk through hormone therapy probably a little bit more. And, if you're seeking out a gynecologist over someone who's still doing OBGYN, a gynecologist is probably someone I would seek out that's kind of not doing as much of the OB side. So of course, they're always OBGYNs, but some will just then leave the OB practice and only do GYN, and they'll probably even have a better conversation with you than someone who's thinking about, oh, I'm going to go deliver a baby and I have to put, someone else is going to do your mammogram or your pap. And so there are certain specialists out there now that are only seeing women who are menopausal or perimenopausal because they have more time to talk about hormone therapy, talk about pelvic floor dysfunction, talk about vaginal dryness, abnormal uterine bleeding. They're gonna be more versed and have more time than when are we going to get you pregnant?
No, right. Gotcha. And then can you just talk about the importance of the labs and about surveillance? Because that's something that you and I have talked before about the fact that the place where I went to get my bioidentical hormone pellets, in my estimation, did not do a very good job with surveillance. I would just go in and get, here we go. We're going again every 3 months, like I said. And now in retrospect, I go, oh, well, I just wonder how jacked up my labs were because of that, because they never knew, and I certainly never knew. So what do
Yeah,
you recommend we demand from our provider about that kind of thing?
I would ask for blood work monitoring. And if they don't have that, I would say next, I'm going somewhere else. I want to know where they're getting, so I do a lot of pellet therapy. I like it. There's less side effects. It's more natural. And I will tell you this difference. The manufacturer that I get my pellets from, the reason why I chose them is how it's put together. So it's equally compressed along the whole entire pellet. So there's not a spike and then a drop. And that's what you are having. And that's what gets you feeling like the addicted part. The other part is whether or not they had you on a couple things to support your hormone metabolism. So there's a product called DIM that helps with decreasing the chances of it converting to, let's say, the bad estrogens, type things. It helps with the metabolism, and it helps with prolonging your pellets. So overall, you want to have a place that is not just treating you as you're seeing the women and men like running in and out. So, where they get their product from, how often they're checking your blood work. Are they doing supportive measures to make sure that, I have some women who only have to see me every 4 to 5 months because we've gotten things so stabilized. And guess what? I get to keep going down on their dose because they're doing so well. So that's another thing that is really important is some of these other places are putting the same dose, whether you're 5 foot and 100 pounds or 6 feet, 200 pounds. And they're just like always putting the same dose in you. And I have a disagreement with that. So it needs to be individualized to what your blood work looks like, what your symptoms are, what other things are you doing? Because a lot of times when I get nutrition better and sleep better and thyroid controlled, you don't need as much hormone. It's kind of crazy. But
how often do you suggest, or is there a range of how often labs should be done if someone is using a pellet?
minimum twice a year.
Okay, gotcha. So that's good.
So at first, when I have a brand new patient, I'm doing it with each pellet round. So I'm doing it prior to the pellet. I'm doing it 5 weeks after the pellet. And then I'm doing it another a week prior to the pellet insertion so that I learn the body's response very well. And then after that first year, I might just check it twice a year, depending on how well they're doing. But I'm staying on top of it so I can, and any new symptoms, you're getting blood work.
Right. No, that's awesome. Okay, good to know. Okay, what have we forgotten to say? We just really wanted to encourage everybody to fight for themselves and get educated, right?
That's the biggest thing. The biggest thing is just to have knowledge. Because I think, unfortunately, we were told you just do what your doctor tells you to do. And I think it does a huge disservice. And it also is a disservice to the physician. I learn so much when my patients bring me in something and say, can you look this thing up and just give me your opinion? I can't tell you how many times I myself learned something because a patient brought it up. So I think having I'll say the boobs to have that conversation. We don't have to say having the balls, having the, to say, I want to become a partner in my healthcare experience. And seeking out providers that do that. That's really, really, really important. Being your own advocate and locking arms with people who want the best for you too. And you're not just a number, you're actually a name with a family, whether it's fur babies, children that are your own, adopted. I mean, we all have a story, and I feel like I've become a part of each of my patients' families.
Right. Yeah. I know that you used to be my PCP years ago, and it was when you worked for a hospital system that really had parameters about how much time you could spend with patients, which was really unfortunate. And so you decided to leave that system. And so many of us are with those kinds of doctors. So they have, it's through no fault of their own, they are in an organization that maybe is treating patients more like a number or more like a bank account or whatever. So we have to be really mindful of that. The other thing is, guys, if you decide to read the book, it reads like a thriller in a lot of the book because it tells you exactly how the narrative about estrogen got hijacked. And it's just stunning to me. It was based on I'm going to say, a couple of faulty studies that were misinterpreted or misinformation got out about them. And the entire medical community went, whoa. And for the last 20 years, all the doctors that we know have been using that information in their decision-making for their patients. And it's so unfortunate because, again, myriad studies have been done since then and before then that indicate that estrogen is so critical for your overall health. So I'm headed to my gynecologist just to let you know, to say, okay, let's figure this thing out. And I'll keep you posted about the results, but it really is, it's stunning information, but I really think that it's worth you taking a look at it. If you're a video person, the doctors that wrote the book have many videos out there, so you can actually look for them on the web as well, and just, learn that way. Just get the information that you need to be better informed and to make your own decisions. So Dr. Mel, God bless you. So glad that you're here. And I may say on tape that I really would love for you to come back and talk to us about all of those reducing risk factors. Would be really great to hear from you because you're so well-rounded, and I just really appreciate your knowledge and your willingness to share it with us. So thank you so much for being here.
Thank you. And make sure you tell your viewers that book is easy to read. So a lot of people think, oh, it's going to be full of all these studies, I'm not going to understand what it says. They wrote it so well that a lay person and a medical professional can read it and get something out of it.
Totally. And I would tell you, that's you and me, right? I enjoy reading, and there are certain parts where I go, okay, that's a little over my head. And I go to the next paragraph and go, whoa, because they digest it for you and make it, I got it. I think I've used up one whole highlighter as I've been reading this book. So it's really, sad. It's sad, but true.
I had to stop driving or listening. I had it both. I have it audible, and I had it paper. And the audible, because I would have to keep wanting to hit stop and put, my little notes in there. I'm like, well, I can't even drive with this. So
right. No, it's packed full of really interesting information. So take that information and then do more research on it, and again, you are empowered to make your own decisions about your health. And so things do not need to stay the way that they are. And, we want you to know that, you guys know that I am a big, I'm not here to survive, I'm here to thrive. And that's what I want for you as well. So this may be one piece of the puzzle that we need to tackle next. So we'll have some really vibrant conversation around this in the Sex After Breast Cancer group for sure. But I know that this interview will go wild as well. So thank you so much for taking the time to see us today, Dr. Melody Rodarte in Gilbert, Arizona.
Thank you.
Thanks so much. Okay, this is Jan James for Hope After Breast Cancer signing off. Till next time, guys. Take care. Keep thriving. Girlfriend, thank you so much for listening to our podcast. I hope you found some nuggets to encourage you and give you hope. Make sure you subscribe to the podcast. You never want to miss an episode. And we'd love to know how we're doing, so please be sure to leave us a review. Until next time, this is Jan James encouraging you to remember there is hope after breast cancer. See you next time.